there's a lot of talk in general about satiety, weight loss, whatnot.
Yeah.
I mean, now in the last couple of years, there's been a bunch of drugs that have come out or that may have been around for a while, just now become popularized. I mean, I'm sure in your clinic you have people. I mean, I see people in the ER who've had like taken too much. You've heard of like semaglutide, tirzepatide, all those different weight loss drugs that are out there that were previously used for diabetes, right? But then now everyone's using them, it seems like. And so they end up in the ER and they're miserable. Yeah. They've been vomiting sometimes. And a lot of that I think has to do with how they give the medicine, how they take the medicine. But I mean, as far as weight loss you're talking about, caffeine does have some benefits for that, but only a little bit compared to these medicines.
Right. And going back to that, there's actually been a huge uptick in overuse of GLP-1s, and one of it has to come from compounding pharmacies. So patients are a little confused. So if you get the Zepbound, Wegovy, all these, they come in pre-dialed syringes, and so patients have no trouble dialing them up and self-injecting. But when they come from compounding pharmacies, they come in these small, 1 ml syringes. People get confused by the units. Am I taking 25 units? Am I taking 2.5 milligrams, 25 milligrams? They get confused.
It is confusing. So what you're saying is when you get it from like the official brand, then it's already in a pre-filled syringe.
Exactly.
It's hard to make a mistake how much to give.
Exactly.
But when you draw it up yourself, cheaper from a compounding pharmacy, then you're doing half the work yourself, drawing it up, and you could make mistakes.
Exactly.
Makes sense.
And people are, giving themselves 10 times the dose they're supposed to be. Yeah. And then there's this huge wave of nausea, vomiting, and they go to the ER.
Right.
So we're seeing a huge uptick in that, and probably has to be with, these compounding pharmacies. And it kind of falls a little bit on, number one, patient education, two, the compounding pharmacy. There's different sort of reasons for that happening.